Okay, good morning, everyone. I know some new rules that we have here with the state is to start 5 minutes after to give everybody time to run in from one meeting to another, but 2-3 minutes is usually what we keep track of. Welcome. Happy New Year. It's 2024 already. Welcome to our MOTS EDI webinar. And I see a hand raised already, just making sure that everything is up and running. And that hand is from?
The hand is from actually Eric Newport. Somehow this came under my wife's name, and I just wanted to make sure I got credit for the class today.
Sure.
I don't know how that happened. She put Teams on my computer for me. So
Interesting. But it's working. You're
okay.
here. Thank you.
Thank
Welcome.
you. Let me get rid of that. There we go.
Okay, so yeah, if everybody can mute, then whoever is talking will be great. Thank you. Welcome, everyone. Like I said, Happy New Year. I hope it's going to be a wonderful new year. And it's going to be exciting because we're working on new systems and we'll be talking a lot about it. And let's get ready and let's get going with the agenda. So, Kayla, if you can show us what we're talking about. There you go. The team introductions, the purpose, roads EDI specs. Jody, our specialist, is going to be talking about that. I'm going to talk a little bit about the transition period, project update, multi-factor authentication in roads, MFA. That's the thing of the last couple of years, and I'm afraid we have to introduce that into roads as well. But it also ups the security of the systems a bit, so that's always helpful with the hackers and the security breaches becoming more and more. So it'll be a good thing, and we'll just have to get used to it, like a lot of things in life. So Kayla will be talking about testing that, roads training coming up. The intro to MOTS is still going because MOTS is still going strong, and whoever is new to the business, to the behavioral health business, it is a good training to do, or a good session to talk about certain things that you might are not really sure about, because everything that's currently in MOTS will be in roads and more. So it's a good, I think a great introduction to the data and the behavioral health system. So switching from CE to EDI, today is the focus on EDI. So the majority of individuals are probably working with an electronic health record, and but it's also, she'll be talking about switching from one electronic health record to another. So that can happen too. We always leave some time for Q&A at the end, but I also like to tell you that we are open to any questions. If you have anything, just raise your hand. And if something's not clear, we can kind of address it right away. And we end up with our contact information. So, okay, let's do a quick introduction of the MOTS team for those of you who do not know us. Kayla, she is our system administrator, and the roads PO, product owner. Cecilia, MOTS support, who will transition into road support, I'm pretty sure. My role is the senior systems analyst for MOTS, but also as a Compass senior systems analyst for several other systems. Mary, similar as Cecilia, MOTS support will going into road support. Jody, our EDI technical expert, and also roads co-PO with Kayla. And then Justin, our specialist in reports and research, and Anna is in a similar role. And I think that's the gang that we have. I think everybody is here today, so that's kind of nice too. Although I haven't seen Cecilia yet, but maybe that's just me. Okay, thanks, Kayla. The next one. Why do we do this? Well, the majority of you probably will know why we do this, and we do this once a month, every first Wednesday of the month at 9 o'clock, just to kind of give you any updates and any information that is changing, things are coming, enhancement of the system. MOTS has been frozen for quite a while, since we are working on the new system for quite a long period now, and even before that, there was not too much going on because of there weren't that many changes. Plus, our support was minimal, so we did the minimal changes that were required. But if there ever is something, this is the perfect platform, I think, to talk about it. We'd like to talk about data issues. If we notice something is skewing the information that is coming and going back and forth to our providers, or we get questions about the data, we always use this first Wednesday hour to talk about data. Get your feedback whenever, and this Teams tool seems to be working pretty good. The other ones we had were always a little clunky and more difficult to control. And maybe it's a learning curve that we all have. I seem to be getting a little more comfortable with the whole Teams thing, so it's working a little better. So whenever you have feedback, you can bring it to the table here, or ideas for future webinar topics. If there are certain things within your organization that you've noticed, or maybe in communicating with other organizations in the behavioral health world that maybe should get some more attention to talk about and get more in depth about certain issues that come up, this would be a perfect place to do it and answer any of the questions that you currently might have, or hopefully we have an answer. And if we don't, then we'll promise you that we will find the person within our organization and get back to you as soon as possible. Next one, please, Kayla. There we go. Roads EDI specs by Jody Kramer. Go ahead, Jody.
All right. Hey, everyone. Good morning. Thank you all for being here with us today. We wanted to talk about the roads EDI specifications. We had originally we thought they were going to be out a while ago, but our latest was going to be by the end of the year. We have had a few more edits to it. And when you see some of the new information, you can kind of, be like, that's a lot more information that you're going to be able to configure your EHRs to send to us through your EDI file. So we really want to make sure that we nail that document, so we don't have a whole lot of issues with it. So we are taking a final comb through it, and we're hoping we're going to be somewhere in the month of January for this. Now, we wanted to kind of bring up a few things because we have had some of our providers and some of the electronic health records um, people that we interact with, talk to us about, what's coming, things you're trying to, kind of set up in your systems to collect. So we wanted to just go over a few areas here on the roads EDI specs and kind of what to be looking for or what to be thinking about. Um, be in sync kind of with your EHR. Values will be standardized with the prior MOTS fields. We're going to be keeping those values similar, the ones that are sticking around and the ones that are keeping the value list, we're keeping those standardized. We do know that there are some of you folks that are really you're proactive, you're right on the the cusp of like, I need to get this set up in my system, I need to get it put into new forms or new data collection points. And so what we're wanting to kind of talk a little bit about is maybe holding off or just taking a pause while we get these specifications out so that you have an opportunity to meet with your EHR and to maybe move forward and think to possibly prevent rework, depending on which EHR you have and which elements you'll be including or not including. It might be good to kind of talk with them because some of this information, as you see in the new segments, and so when we talk about segments, for those of you that are familiar with the actual EDI file that comes into MOTS today, there's what we call segments of data and different segments that are allowed to be sent together. And the different segments collect different types of data. So like currently we have a client profile demographic segment, right? It collects that type of information on the client and sends it to us. We have behavioral health. We also have, addictions currently, crisis, and involuntary services. So what we've done is we are keeping the same file formatting concept and structure. So we are adding additional new segments. So as you'll see, Measure 110, stabilization services, intake and discharge is included in that. Mobile crisis, the appended pieces to a standard crisis that is out in the field and is mobile. We have Real D and SOGI that will be included, and that is the full 60 to 70 set of values. It's that full questionnaire and assessment that you go over with a client when you first come into services. and that you typically update at a minimum of annually. And then we have some additional pieces for service elements, and these are just going to, that's an actual field that's coming in, and it's going to help us and all of you to tell which reportings kind of tie to which service element. And service elements might be a language that is familiar with the counties and other folks that contracts directly with OHA and the Health Systems Division, because those are within the contractual language. And this is really going to help us make sure you all get credit for those particular areas and those different metrics. So we're really excited about that. But as you can see with the Measure 110, stabilization, crisis, these are standard this is standard data that's going to have to be collected by all that it applies to, right? It may not apply to all of you. It may only apply to a pocket of you for certain things. But as you're doing your builds in your systems and you're trying to collect that data currently, because you're all kind of reporting on it already, some of this is going to Oregon Health Sciences University at the moment for us on behalf of us. And so just wanting to let you all know what's really going to be coming in these documents and the specifications. So, when you talk with your EHRs, it's possible, I don't know for sure, right? But, they might want to try and standardize some of this because there's a lot of moving parts and pieces, right? To take what you enter at your users level to actually getting it in the file in the correct format to send it electronically to us. So I guess the bigger point of the story is just to hopefully, in the event we can prevent any type of rework, or maybe you're midstream of getting some of this set up. We just wanted to make sure to share that with you all so that you had, an idea of what additionally, some of you may have missed, one of our other webinars that we've had back in, I think it was October, November. But anyways, just felt compelled to bring this up. If any of you have any questions surrounding this, or if your EHR is, we're happy to meet, just contacting either the roads or the MOTS support or myself. And we will make sure to meet and kind of, we can talk about maybe impacts or opportunities that are going to be available with this shift to the roads and the EDI specs, which we're calling it roads EDI V2 version 2, because since roads will be accepting the MOTS legacy data, we're calling that version 1. And additionally, once these specifications are out, we will be actively working with all of you and your EHRs on, technical meetups or what we need to do as you progress through on your projects. So with that, Pete, I will pause. I'm trying to see if there's anything in the chat. I don't see a red dot. So
No, I think you were nice and clear. Thank you, Jody.
okay, thanks.
And it looks like a lot, and it is a lot, but like Jody mentioned, it's already something that we all have to work with and already are required to report to the state anyway, or different organizations. So we try to get them all into one system and kind of standardize a lot of it. So excellent. Okay, thank you. Next slide, please. That is about smooth transition. There you go. That's me, the smooth transition guy, smooth operator. What to do to ensure a smooth transition? And then I'm talking about a transition from MOTS to roads. We all know it's coming, and we all like to be it as smooth as possible without as any hiccups if possible. And we all know there's going to be some things and some issues and things will happen, and eventually we'll sort those out. But in order to be ready to prepare, and we still have a few months, so I would really like to ask all of you to make sure that all the errors have been corrected. We all know we send our files, we get some error backs and some more than others sometimes, and I would really like you to make sure that you check, and because sometimes they get pushed a little to the background, and I'll sort them out later. But the more up to date you are, the better the transition will be, because everything that is currently in MOTS will go into the road system. So if there's currently errors and we take that kind of imperfect and data from one system to another with bits and pieces that are out of sync with your EHR, then it's going to make it more difficult, because where was it through the transition, or was it already in the new system that's a little different, and can we find it, and where was it in the old system, and is it still there? And so these little things we really like you to check, because it can be maybe the data never got into the system and you think that your data was accepted and you're trying to make an update and it's not taking the update because the initial submission didn't go through. So that's why it's very important to make sure that you have the errors that have been reported in the last several submissions, to really take a good look at it. Internal procedures, also one of the things that we always like to rehash a little bit, is that make sure that your organization is ready for any errors, and how are the errors been taken care of, because sometimes people change responsibilities, their tasks, their position within an organization changes, and certain jobs that were part of somebody's work all of a sudden don't pertain, or were supposed to transition to somebody else, but they got dropped and they weren't really picked up. So we also would like to check and make sure that is everybody responsible for certain parts. Is the chain, is it closed, or are there certain gaps in it, and who is going to fill those gaps to make sure that we really get those errors taken care of and those fixes made. Another thing that we also like to ask is one of the issues based on the fact that a merge is necessary, because that's a tricky one, and the merge has always been it was supposed to be built for us that we could take care of it ourselves, but OIS, our IT support team, never got to it, were too busy, or didn't have the support that we needed at the time. And they do take care of it, but it's usually something that has a very low priority for them. So we kind of pile up the merges that we need for all the different providers and clients, and then we kind of show them, okay, and then they set some time apart, they look at them, do the research, and make sure that the mergers are taken care of. Because if there is something necessary and that gets taken to the next system, we're not really sure how that happens. And sometimes certain records are in the system and blocking other records. We know that if there is a crisis, then you won't really see it. So that's one of the things that I also would like to ask you is make sure whoever is in charge and responsible for the active client list that comes in once a month, and I know there was a little hiccup with the new year, but Justin took care of it, because I assumed Justin took care of it because I hadn't heard anything about it after that. So that's usually a good thing. So please take a good look at that list and make sure that everybody that we think are currently active in the system are currently active in your system, that the systems are in sync. That's also a very important thing, because if the transition, there's some disconnect, then it might be a bit of a problem as well. So that's kind of what I wanted to do. I'd like to talk to you about the smooth transition, and to make it as smooth as possible, and really look at the information that's in your system and ours, that they are as close in sync as they can be. So I hear little pops, but it might be something else. So
thanks, Pete. It looks like we had a question come into the chat,
and that was about
when you say
submissions.
Yeah.
When I say several submissions, I'm talking about the last 2, 3, 4. It depends on how often you submit. If you do it once every 90 days, or the updates, or sometimes certain submissions come in on a regular basis. It kind of depends. Basically, all the errors would be great if they can be fixed and corrected, but we know that it sometimes takes a little extra work, and there's not always individuals available to take care of it. So or the expertise is not there, or the person is not there, because especially with the holidays, it's been a bit of a, it's always a bit of a mess here and there, and a lot of people are finally given the time to enjoy a great time with family and friends, and travel a lot. So that's why I say several submissions, because normally I would say just look at the last one, because that should have everything in it. But there might be one or two missed in previous submissions. So if you do it on a weekly basis, maybe look at the last four. If it's monthly or if it's daily, look at the last week. It kind of depends on the way your system is set up and how to submit your data submission. So that's kind of what I was trying to say. I hope that answers it.
And one thing I'd like to add, Pete, is that
Sure.
and so the errors are specific to each individual file. So you're going to get your errors returned to you based on the file and the batch and the clients that were in that particular file. So you do have to, address those results files to look for the errors that correspond to the original submission. And just for anybody who's new, if somebody does come back as an error on your report, your results file, that client didn't make it into MOTS. That submission, I should say, didn't make it into MOTS. So we don't accept them partially. If they have been in error, they need to be looked at. They need to be corrected in your system. And then however your rebatching process works to resend them, then you would resend them once they are corrected. And if any of you have any questions on this, because all EHRs are a little different, please feel free to reach out to us, and we can help you understand that. So Pete, I'll pause there because I think you had another question.
No, I think that was it. Or is Kurt trying to ask a question?
Well, there was one that says, can you compile a list of all errors from one organization? And the way that the system is set up and designed is when you send a file with a specific file name and a batch number with the clients and the submissions within that, we send back one results file that corresponds to that. So we don't have a way to put them all in one list.
Correct.
Or
Yep.
send it in one file. Yeah.
Yeah, unfortunately that we can't do that, because we don't know what the issue might be, if it's a new one or an old one. Because if a record was rejected and you're trying to update it, we don't know if that's a new one, or if that is an update, if the previous one wasn't accepted. So you have to look at several, because if now you're thinking you're doing an update on an individual, and that person in the previous submission wasn't accepted because of an error, then we don't have the knowledge. So you have to look at several of the previous ones and kind of do a little sleuthing to figure out where it's coming from and what it's doing. So that was the way of saying it.
I would. Yeah, and MOTS is just very sequential in how you submit information on your client. So like Pete said, if you missed the initial submission when they were active to begin with, depending on what you're trying to do with your update, if you're trying to tell us that you've discharged them or they completed treatment, MOTS is going to say, well, wait a minute, I didn't get the first one. So MOTS is super sequential, and ROADS is going to additionally be super sequential. It just helps us to make sure that what you're sending is in the right timeline, in the right periods. So mastering MOTS while MOTS is still around is going to just help you continue on the smooth transition to ROADS, because a lot will be very familiar.
Correct. So there is no way to how many outstanding corrected MOTS errors there have been over a period of time. All we can say is, because they can be related. So if, like I said, if an update, and that's why I mentioned to take a good look at the active client list that is sent to your organization every first of the month. And if you don't get it and you're responsible for data submissions, check within the organization or check within the system, ask us. We can check where the active client list is sent to, who it's sent to, because we only have the the primary contact that will receive that information and get that list. And if that is going to a person that is maybe no longer working with your organization, and you might not get it. So that's a very good checklist to make sure that all the active client lists that you see are similar with the active clients that you have within your organization, then you're already on a pretty good start. So
yeah. And thank you, Justin, for putting that in, because there is a way to go deeper into the system to determine, the, kind of rates of certain aspects around your data submissions. So thanks, Justin, for putting that out there.
definitely. Excellent. Okay, thank you. I think that was what I wanted to tell everyone. So we go to a project update. Jody, back to you again.
All right, super. So yeah, the roads project, we are cruising down the road. We are currently in what we're calling a development cycle 4. It's getting towards the latter part of our cycles. Our go live date is currently expected around April of 2024. We're not sure if that'll be at the very beginning or the very end, but we do know that we are looking in that Q2 April-ish timeframe. So be on the lookout for opportunities. I know Kayla's going to talk about a few things, but opportunities to help us out early, when the trainings are going to be coming up, the different types of training that we may have. If you're wanting to be like a super user for your organization, just different things. We're going to have a lot coming down the way. So just keep your eyes out. We'll continue to also do updates such as this here. So we are still, we're cruising along nicely. So with that, Kayla, I'll turn it back to you.
Factor
All right, thanks,
authentication,
Jody.
MFA. Go ahead, Kayla.
Thank you. Can everybody hear me?
Yes, we can.
Okay.
I can. Sorry.
Great. I'm assuming that's everybody then. I'm just going to briefly talk about multi-factor authentication in roads. I know Pete mentioned it in the beginning that it's just something that has to happen. It's not a road specific change that's being made. It's a statewide change that's being required from all state contractors. So any MOTS user or roads user who will have a P number will be required to use MFA to log into the system. And this is really to make sure that our data is secure. We've heard, I'm sure you all have heard of these different scary stories of data getting held hostage, and there's a number of cities and states that have had this happen, and we really never want that to happen. And in order to protect our data, we need to make sure that people who are accessing the data are really the people that should be accessing the data. So MFA will be accomplished in one of two ways. We'll be asking folks who are able to download an app on a phone, and we'll be able to walk you through the process to configure MFA via that app. And then for those folks who won't have an app available to them, there is an option to use a YubiKey. And we're working on drafting up some one-page documents that makes this information really clear. But a YubiKey is essentially a physical token that is used to confirm your identity. So some people are going to be able to use an app. For those folks that won't be able to use an app, you'll be able to use a YubiKey. The only difference is that a YubiKey will require an app be downloaded on the computer that you're going to be accessing roads through. So there's going to be an app download either way. It's just really where the app download happens that's going to be able to change. And Kurt, yes, if any, I'm answering a question in the chat that Kurt said, and it says, do we need MFA for submissions?
That's a no.
Right, that's a no. The only people that are going to need MFA are folks who want to access our portal. But Jody, do you want to go further into that?
Well, the only thing I would just add to that is that, we know currently most of you, probably 98% of the time, never access the MOTS web portal, right? You're accessing the SFTP, your file transfer software, and you're sending your stuff from your servers or locations to our systems, right? Because it's doing it in the background through those authenticated ways. But the Rhodes web portal is going to be different in the aspect that you're going to actually be able to see your clients. Okay, you're going to be able to see in a read-only fashion what client submissions you've had, what the client's currently doing, what it looks like in Rhodes. You're also going to be able to have some additional tools where you can look at your results files and you can look at your submissions. So we've built, I'm pretty excited about it. So we've built some things into the Rhodes web portal that were not in the MOTS. So most of you will probably want to, at some point, as Kayla and our team reaches out to you, get set up with this multi-factor authentication. It's always important to have at least one person, and ideally a backup, that has access to the portal so that you can, because that's where your agency and your facilities are set up and different administrative things to set you up. So with that being said, not for SFTP, but it will be for the Rhodes web portal, which I'm sure you're all going to be excited about, or the great majority of you.
Great. Thanks, Jody.
Yep.
And I'm going to go right into my next one, which is still MFA focused. We're just asking for folks who are willing to be beta testers. Because MFA is a new process for, well, we're not using it for MOTS and we will be using it for Rhodes. We want to make sure that we're able to refine those instructions to get all 400 Rhodes users through when the time comes. I have a list of about 10 folks who are willing to be beta testers already. So if you've emailed me, I have your name, and we'll be reaching out to you this week about when we're gonna set up a time to do this beta test. And what's a good thing about the beta test is that once you're configured for MFA, you do not need to do it again. You're good to go. So if you become an MFA beta tester, once you'll start seeing emails from us planning out MFA meetings and webinars to get folks through. You don't have to worry about that. You'll be ready to go for Rhodes training in March. So if this is interesting to you and you're willing to help us out for an hour in a meeting, please let us know in the chat or reach out to us via email, and I'll put you on the list and get you the information once we'll be done with it this week. So we're working on getting that set up now, and so you'll hear from us shortly.
Thank you, Kayla. And it's back to Joni again.
Yes, this is the exciting part. Once we're actually training for Rhodes, we know we are very close to the horizon of being there. So as Kayla mentioned, Rhodes training is being planned at the moment for March of 2024. We are going to be keeping folks up to date with training schedules and different things, and available times for you to attend. I suspect these will be hosted through Teams, and you'll register or do similar things that you do to attend our other informational sessions. Anyways, prior to the Rhodes training, as Kayla mentioned, we are going to need to have you configured for MFA, because whether you're accessing it for the EDI features that are within it, regardless, you're going to need it. So for any of you who do have some time and bandwidth to help us out and be a beta tester, as Kayla mentioned, you're already going to be ahead of the curve. So, but yes, please keep your eyes out. You're going to start seeing more and more communications from us, because there's going to be a lot of new things coming down that we're going to need your involvement with. So, yeah. There was a question here. I'm just going to answer it. Have the EDI specs been published yet? No, they have not been published to the EHRs or the providers. We are in the final last comb through of them on our side. So hopefully within the month of January here, we will have some information on that. And we have been keeping the EHR vendors that have been reaching out to us. So the ones right off the top of my head, CareLogic, Credible, Ocean, Epic, Dr. Cloud, Reliatrax. Those have been folks that have been extremely engaged and doing touch points with us to see where we're at and what we're doing. So for any of you that use those systems, they are in the loop of information. If you didn't hear your system's name, feel free to take an opportunity to connect them with us and yourself, and we'll be happy to answer any questions.
Thank you, Jody. And then we go back to Kayla again.
This is just our anchor slide of our Intro to MOTS webinar that we host the second Wednesday of every month. This is for folks who are new to MOTS or who may have new MOTS responsibilities at your agency that you didn't have before. It's just a time that we can get together, answer questions that you have. I do a quick demo of the system and really talk about the data that's in there, why we collect it, and what that data is used for. I can put the link to this webinar in the chat right now. The only change with this the webinar in January is that we had to push up the time. It's usually 10 o'clock, but this week or next week it had to be 9 a.m. because we have an all staff meeting later on in the day, so it wouldn't work out. But that's why I highlighted it at 9 to 10 a.m. It's a little clock, so I could remember to say that piece. But yeah, if you're curious about MOTS or have questions, feel free to join us. And if you're a MOTS pro, like I'm sure a lot of you are, you can ignore this slide.
And for those of you thinking, oh, MOTS is going away, so I don't have to bother, it is a good starter. Like I mentioned earlier,
yes.
MOTS has all the data that you will see back into the road system as well. So it's giving you an idea of how we work and what segments are kind of going together. And it's all going to change a little bit, but you have a nice basics training already in there. So you're pretty already one up for the road system. So
yeah, that's a good point, Pete. Roads is really building off of MOTS, so everything you learn about MOTS will mostly stay the same about the information that's going to be going in there. So it is useful. And I guess we will go back to Jody. This is a real Jody Kayla show today.
Yep.
One thing I would like to also add about the Intro to MOTS training, as Pete mentioned, it's foundational because really we gave the new system a new name, but MOTS needed to get onto a more current platform. And so this is really a MOTS replacement plus additional data that we're bringing in so that we can help reduce administrative burden with you having to all report into so many various locations. So the other thing that I've gotten feedback is if you have folks even within your organization who are like the people entering the data maybe into your system, and they're just not sure. They're like, why do we have to do this? Or, this takes a lot of time. Or, we've had folks attend the Intro to MOTS just for that, because the first part of it really explains what it is, why we do it, why it's important. And it really empowers those people to understand the impact that they have in this whole circle of the client coming in, everything being, paid for, reported, provided, and then the outcomes. So if you have any folks like that that you think might benefit, it's really super. We've gotten super feedback. So switching, this says from CE to EDI, but really it's for this purpose, it's mainly if you're switching EHRs, which and I shouldn't say a number, probably maybe 3 or 4 have reached out that are doing EHR switches. And if you are changing EHRs, what I want to kind of point out, besides these obvious points we go over here, is that it's still important to set your MOTS up the way that that EHR does MOTS and collects the data. So if you're going into a switch, you know, from one to another, and you're like, I'm just going to wait till roads comes up, and then I'll worry about getting the MOTS module or the MOTS piece set up. Don't do that. That's a bad idea. You're going to want to just continue with everything as though you're reporting to MOTS, because where I mentioned that MOTS is version 1, the legacy, those will be accepted by roads on go live. So nothing's really going to change for all of you that are currently submitting the MOTS. When that switch happens, roads is going to pick up and start ingesting your data and giving you results files. So please don't think that you don't need to do that body of work on your EHR transition. So what's most important about your transition is letting us know. Like the 4 or 5 that we know of, let us know 3, 4, 6, 7, 8, 9 months ago, literally. Some of them are coming up in April, right when we're going live as well. But that's pivotal because it helped us to understand, like, okay, we're going live in April, but I also and our team have 4 or 5 of you to support in April as well, because you're also going live with your systems. So letting us know is important. If you're looking at switching EHRs, you probably already have done this, but important, just know the MOTS functionality, know the roads functionality within that system. What are the processes? How does it work? Who's going to be required to do what? Because there's a myth out there that once you go to EDI, nobody has to do anything. And for all of us that have been doing it, we know that that's like not super true, no matter what they say. So no one way is better than another. Just understand the differences, and it helps with your workflows. Project timing is super important to your teams and ours. So notification assists with that. The process for, we won't be doing a switching necessarily of your data submission, but what we will be doing is uncertifying the old system and setting you up to be able to bring in test files for the new system. So that certification process will happen with your new system. Your SFTP, the secure file transfer thing, that's going to stay the same. That's unique to you and your organization, regardless of what EHR system you use or don't use. Okay, so that won't change. We would like to figure out your client IDs. You know, you might have to change them when you go to a new system if you continue to report within your same facility in MOTS or roads that you have been. So we want to talk about that, figure out how we get our arms around what that means. Define your business processes. That's kind of on your side, but once you know your functionality, this piece is super helpful. And we've got some, you know, we just have a lot of experience of doing this for 10 years, and Pete longer than the 10 that I've been doing it. So if we can ever help just give some insight, we're not here to tell you what to do or how to do it per se, but we do, if we can be of value to share information or connect you with another provider that might be beneficial to talk with, we're happy to do that. The testing of the EDI files, that is going to be something when you switch electronic health records systems, you're going to have to recertify. Now, when we go from MOTS to roads with version 1 that you're already sending, you will not be recertifying for version 1. Version 1 is just going to come into roads and do its business just like it's been doing today. But when we do get to version 2, there will be testing of those files and certification. But anyhow, we'll talk about this because you're all going to let us know like super early, right? So we'll get these things nailed down right away. And then, of course, you're going to go live, and that's when all the excitement really starts. And then what we do is we offer some follow-ups. And what that means is it could mean you want to follow up with us weekly, you want to bi-weekly, monthly, or maybe you don't need one, and that's great too. But once you're live and the real excitement starts and you're getting your things and errors, you know, because errors are normal. I mean, you're not going I shouldn't say never going to get errors, because that is possible. We have some providers that have a super low error rate. But it's not abnormal to have some errors when you submit your files. So the follow-up is really great to help you understand what that may mean to you with your new system. So with that, I know there was a little extra mumbo jumbo from me in here, but I just kind of wanted to point out a few things that kind of came to mind as we were talking so much about the roads system in this webinar. So thank you all for your patience with me.
Thank you, Jody, and thank you for pointing out that I'm old. So, yes, the good old days when, for those of you who do remember, there were tiny floppy disks that were sent in an envelope, and we got data on that. So that's how far back I date. So, okay, Q&A. Any questions? And I think most of them have been answered already. I saw them pop up, and I saw people quickly respond to it. So I don't think there's any questions yet. So for those of you not familiar, but we always record this in case you missed a piece or you're not sure about it, or you want to reread or re-listen to a part of the webinar, or maybe a coworker might be interested and wants to know what we were talking about. We set it out under our webinars and newsletters, and the newsletter is the MOTS Messenger. We also send that out on a regular basis. So if you prefer that over listening us go on and on and on about certain things, and you just want to pick some articles, the MOTS Messenger is great and has all the information in there as well, and has a lot of updates and news flashes that are important to you. Okay, as we mentioned, the next webinar on February 7th is from 9 to 10, and the signups are available on the website as well. And I think that was all we had today. And it's almost, yes, it's a perfect timing, actually. The contact information, we are all oha.oregon.gov. We used to be that really long one, .state.or.us and all that stuff. It's all gone. It's all it's all Oregon.gov these days. The MOTS website, there's a link there. Our email support and road support is also there as well. So in case you have any questions, and I think it's the same after the @ sign. Before, I think it's roads.support, or is it just roads? Kayla?
Just roads.
Just roads at
Yep.
ODHS,
Mm-hmm.
OHA.oregon.gov. So maybe next time we'll put that on there so you guys can see that in case there's any questions that you might have. Okay, anybody from the team that I might have missed or didn't answer? No, I think we're good. Excellent. Well, thank you all very much for joining. Have a wonderful rest of your day. Take care. Bye-bye.